Hey guys, Dr. Rimka, and I am prepping to go to the gym. A few of you have been following. I'm trying to finally build more muscle to rehab myself after the really difficult lumbar disc re-injury and kind of autoimmune or biotoxin illness attack of my discs and my sacrum and my nerves, and haven't been able to do anything physical. So a lot of you know I'm trying out ARX Fit right now. It's a very specialized machine. It's really big with all the peak performers, like Tony Robbins has been using it for like over 10 years. Dave Asprey is touting it like crazy. You know, he's not selling it, but he loves it. So there's a lot of science that goes into the ARX Fit. What I'm loving about it is that I'm certainly noticing changes. I've only had 3 workouts, but the beautiful part is it takes 20 minutes once a week. And you end up working your muscles so hard because it's part of the design of the machine that you normally can't do it that way, that you need a lot of recovery, and then the body grows a lot. So really all healing, all growth, everything is in the rest. I want you guys to remember that it's all in the rest and the recovery. Now when we're young, we can get away with almost anything, right? You can beat your body into the ground, and for the most part, it's gonna still recover. Hey, Narita. But as you know, Mama's, we're creeping up in the age here, and we got a lot of us up here now. We need to really be concerned with rest and recovery, and I get really concerned when I see a lot of the kind of clients I have, a variety of patients, whether they're coming in for a lot of physical distress, pain and discomfort, or mental distress because they're anxious and stressed and fatigued and just really overwhelmed. And it's a lot of women who are hitting the gym many days of the week and they're not getting any results. And the reality is they're just kind of ripping their body apart and increasing inflammation. And often they're just gaining weight because the body's going to retain a tremendous amount of water when it's inflamed, when it's damaged. So when you go to like lift weight or when you run or something like that, you are stressing out the body in the hopes that it's going to make an adaptive response, okay? So you rip things apart, basically, and the body's like, whoa, that was hard. What the hell did they just do? And so it repairs that tissue, and it says, well, I'm not just gonna leave it like it was. I'm gonna make it better than where they started, so in case, we do this again, it won't hurt. So that's what you keep doing over and over again. It's why people increase weights if they're lifting weights, okay? It's why you get stronger. It's why you build more muscle mass. So I'm on my way to go do that, and I'm a little bit sore and a little achy, and in particular my low back is the issue that I'm working on. So I just wanted to say a lot of people aren't preparing, especially if they have an autoimmune or inflammatory disorder and they're just trying to tough this stuff out. So I've already rubbed CBD oil all over different parts of my body, especially my low back. But I'm hooked up right now to my compression cryotherapy machine. So I have a game ready portable one, and for chiropractors or other people out there, I really say you're looking to get one of these for your practice. It's portable, so I can have it at home, I can bring it to the office, I can use it on clients. So for my chiropractic folks or people who are coming in, if you want this, you need to kind of request it ahead of time to make sure I'll have it. So this is what we do with it though. So it's a little machine, and there's ice all in here, and I make these adjustments on the setting, and it runs through this hose, okay, that's coming out of there. So cold water is running in, and I'm wearing this belt around me, and there's a special, see I can feel it on my back, it's compressing, so it's bringing in water, cold water, and it's doing a lot of active compression and decompression. And so it's like kind of artificial exercise on my muscles. So it's forcing a lot of blood flow into the injured area, which I need for inflammation, but it's bringing cold air in through parts of the tube and then taking water, really, really cold water, 34 degrees. And then it's taking away the heat I'm giving off. So it's basically pulling off all this inflammatory heat out of the injured area. And you can tell with somebody how bad it really is because of how much ice is going to be melting. You can just see it. You have some people who put it on, it's like hardly anything, and somebody else will just wipe the whole thing out. You're like, holy Moses, you got really, there's a lot of inflammation and heat coming off that joint. So you can do the low back, you can do the knee, you can do the shoulder, you can do the head. There's a lot of different things. I only have a low back and the knee, so people in my practice just know that because I don't need all the sleeves. But if, look for, a doc that has a Game Ready near you. A lot of sports teams are carrying them now. But I'm preparing. So I'm doing it only 15 minutes before I go. And I'm going to drive over and do my workout. And then I'm going to take it with me and plug it in there because they'll let me. And I'll ice it right after the workout on that low back. So I've been feeling it a little bit when I'm actually training. And I'll actually do a video at some point, but I got to have somebody hold the camera for me and everything when I'm doing an ARX so you can see what it is, how hard it is. But preparing and recovering, it's critical. I mean, all of us in our 40s and up, that's all the magic. I do not want to work out harder. I do not want to train more. I want to do everything smarter so I can do less and less. It's just tremendous output for a very short amount of time and a lot of recovery. A lot of recovery. So I don't, re-injure myself. I can deal with the inflammation that's still present that I'm still managing. I'm still getting prednisone injections in my back. I'm still doing these things. So just want to let you guys kind of know about that. And I think it's a great thing. So if Google Game Ready and see if there's some compressed cryotherapy. It's not just an ice pack, which is, if you just got ice, throw some ice on before and after, right? Throw some CBD all over it. Take some CBD orally. There's a bunch of other different analgesics you can do. And again, the recovery, sleep, and what you eat are critical. So after I do this, I'm not going to have any sugar. If I go eat some sugar, anything like a sugar, I'm going to devastate the growth hormone my body is trying to make. And then from there, they're making the testosterone. That's what's going to burn fat. That's going to build muscle mass. The whole point of me doing this is to get the gold currency of metabolism in my body, which is muscle mass, okay? I'm not actually looking for flexibility and movement gains and all that kind of stuff. I'm looking for a tremendous amount of muscle mass, bone density increasing, hormone sensitivity with this type of training I just started, which is once a week for 20 minutes, and I love it. Okay, see you guys later.